So starting the end of January until mid-February where we are right now, we've had a lot of reports of GBS cases in India, or the Guillain-Barré Syndrome. I'll tell you what that is. But as of 15th of February, Maharashtra has reported 207 cases with 8 people dead. We've had 2 deaths now reported from Andhra Pradesh, a 45-year-old woman and a minor boy. Now, I'd particularly put off reporting this story up till now because I was waiting for clarity from the medical community on what exactly is causing it, because the worst thing to put out at this point is misinformation or panic. But while we wait for that clarity to emerge, what I have done is put together all the information of what we know so far and what we can do to keep ourselves safe. And a breakdown of what it could be causing this in India. We have to start with what is GBS. So what is this Guillain-Barré Syndrome? And I put down some notes because we had to look through the internet for previous studies, for global studies, right? So this is called an acute ascending onset paralytical polyneuropathy. Hang in there. Acute because it's quick onset and it moves very quickly. Ascending paralytical because it apparently starts at the extremities, which is your toes and your fingers, and moves upwards in the body. It's a polyneuropathy because it attacks your peripheral nerves or your sensory nerves, which is why sensation is the first thing that suffers. It's triggered normally by an infection. So when the infection enters the body creates antibodies to fight that infection, all infections. These antibodies are sort of like the soldiers of the army that the body has internally to fight off any infection. Now, in some cases of GBS, this has been caused by an infection or a bacteria called the Campylobacter jejuni. We can call it CJ, but Campylobacter jejuni bacteria. When it enters the body, there are antibodies that are created, and in some rare cases, those antibodies get confused because this bacteria looks a lot like, and I'm being very simplistic here, so medical community people, please bear with me. It looks a lot like some of our nerve cells. So in some rare cases, the army that is formed by the body to respond to this bacteria gets confused between the bacteria and the nerve cells and also attacks the nerve cells, and that's what causes the numbness, and then that increases across the body. Now, it's important to remember that not all diarrhea is CJ. It's not this particular bacteria. Not all CJ results in GBS. It's really rare. One doctor has said it's a 1 in 1 lakh case. So if there are 1 lakh people with like gastroenteritis and diarrhea, then one of those people could actually develop GBS. It starts off with numbness, with weakness, with a loss of reflex, and it's normally about 4 weeks after the diarrhea that the GBS symptoms actually start off. Again, we have to remember that not everyone with GBS is going to have severe GBS. You need an IV, and in most cases people recover. In about 5% of those cases, it gets very serious, requiring ICU intensive care. And in some cases, there are respiratory complications or heart complications that could lead to death. Now, this is the global research on GBS so far. In 2/3 of the people who have that infection, in some cases it has been found that it's actually caused by the Campylobacter jejuni bacteria. In some cases it was also the Zika virus. Like for example, in 2023 in Peru reported 200 suspected cases and 4 deaths of GBS. The government declared a national health emergency and strengthened public health measures. In that case, in those 200 people, 2/3 were linked to the Campylobacter bacteria. But in 2015 in Brazil, there were cases of GBS that were linked to a response to the Zika virus, where the body was responding to the Zika virus. Now, this is why it is baffling doctors in India, because it's a rare response to a particular type of bacteria. But why is it happening in clusters and in such a large scale? Now, the clue that has been found in India is diarrhea. It's been found that in most cases, those people who have been diagnosed with GBS have had diarrhea. The Director General of the Indian Council of Medical Research, Dr. Rajiv Bahl, has said that investigators are working on this clue. They are actually trying to figure out what caused the diarrhea to begin with. He said, the case or the association of GBS has been found in 40% of the people who had diarrhea. Normally, there are 6 infections that precede GBS, and they're trying to figure out what that is. Specifically in Pune, remember we're talking about a little more than 200 cases. 21 of those GBS patients in Pune have been tested, and they have found the Campylobacter jejuni in 4 of those samples. So out of the entire 200, you've tested 21, and in 4 they have found this particular bacteria in their stool samples. So there are more questions though. For example, if we take a look at the Campylobacter jejuni bacteria, in 1990 in rural China, there was an outbreak of GBS, and the pathogen was discovered, this bacteria was discovered common among chickens in their intestines. And it found out that the GBS outbreaks occurred every monsoon when children played in water that was contaminated by chicken or duck droppings. So it was not so much what they ate as poultry, but if the droppings of the bird contaminated the water that was consumed. Now, it's not like GBS is entirely new to India. We've had it in the past. In fact, in the National Institute of Mental Health and Neurosciences in Bangalore, there were doctors who tested 150 GBS patients between 2014 and 2019. And they have found that 79% of those patients had prior infections. A third of those were Campylobacter jejuni bacteria, and they were also, very importantly, 65% noted that there was bacteria actually mixing with other viruses. It was creating sort of an interplay cocktail of bacteria and viruses that the body was then responding to, and that is what the problem was. Now, globally, GBS has come from undercooked poultry, but also from the spread of water that is contaminated, similar to cholera or salmonella. And so now let's take a pause, right, and say, if it is undercooked poultry, then how could it possibly be that these many people are all undercooking their chicken all at the same time? And also, are they all eating chicken, or could some of them be vegetarians? These are questions that have not been answered so far. But is it also possible that there is a large scale contamination of water where people are consuming that could be infected either with droppings of birds or animals or fecal matter of human beings? Now, this is another question that needs to be examined, and apparently that's what they're looking at. Now, specifically with Pune, the question that some researchers are asking is this: could there be a large scale contamination of water where a large number of people have consumed water contaminated with some or the other form of fecal matter? Because apparently the bacteria can move through the system and actually come out of the system through fecal matter and find its way back into the system through contaminated water. I know, I apologize, but we have to talk about it. And where could that have happened? There's one researcher called Dr. Jesse Sakaria, is a doctor, an independent researcher, has said that this sort of infection triggering GPS could spread among crowds through fecal, oral or droplet transmission. Now, as of January or the last week of January, the government had not given out a completely clear official reason of the outbreak, but the Director General of the Indian Council for Medical Research had said that a lot of samples are being collected and tested right now in the Institute of Virology in Pune to find a common link in why people are suffering. So they're testing stool samples and they're testing blood samples as of now. Now, I also want to point out that this is, while we know this, or this is what we know so far, in the meantime, the Deputy Chief Minister of Maharashtra has urged people to avoid consuming undercooked chicken as a precautionary measure, and said that there is no need to cull chickens. And he also said, and I'm quoting here, recently a GBS outbreak was reported in the Kadavasala Dam area in Pune. While some linked it to water contamination, others speculated if it's caused by chicken consumption. After a detailed review, it has been concluded that there is no need to cull chicken. He advised people to ensure their food is well cooked, to actually prevent any sort of contamination. Again, it's not clear really from this what is causing it, but like I said, GBS, when the health minister of Andhra Pradesh reported those 2 cases, he said there are 17 cases of GBS in Andhra Pradesh. It's a non-communicable disease, which means that it's not contagious, and it occurs at 2 people out of a 1 lakh population. So this is not a sudden spurt, this is actually normal. So fundamentally it comes down to two possible causes. Undercooked poultry. Now in India we normally have a case of overcooking our food because we pressure cook the living daylights out of everything. But is there a possibility that if you're handling poultry and the utensils are not, are not being washed properly afterwards, if that's the case, and it's a precaution we must take, how could it be a precaution or a problem across the board? But it's a precaution we must take. The other problem that we have to consider very carefully is contaminated water, because that could be a large-scale lead, and the way to take precautions against that is to only consume purified and boiled water, because only when you boil something to bubbling point do you kill any bacteria that might be present in that water. And be super careful about consuming anything outside of the home that might not have been, where the utensils might have been washed with water that's not clean, or your fruits might have been washed with water that's not clean, or even unclean water might have been used to prepare the food that you might be consuming. The bottom line though, and I say this, very measured and very carefully, is that while we have to take all of these precautionary measures at home, there is a huge responsibility to be taken by the governments of all of our cities and our states to ensure that the water that is being piped into anybody's home, including the street vendor and your kitchen and your bathrooms where you brush your teeth, that water is safe, potable water and is not contaminated with sewage or is not contaminated with droppings of animals or of birds. And that is a responsibility only governments can take. We cannot actually mitigate against that risk, apart from boiling everything, but you shower with that water, you brush your teeth with that water. So these are precautions that we must urge our governments, all our governments, to take to make sure that the water that comes into people's homes is actually potable and drinkable and is safe to use. We're also inviting a doctor to speak with us about this tomorrow at 7 o'clock in the evening, India time. So leave me a question in the comments section if you'd like to ask a qualified intensive care professional on, all of these questions that we might have about GBS and how to prevent it and what to do and how to detect. I will ask those questions on your behalf, and we'll go live at about 7 o'clock tomorrow evening, India time. So leave me any comments you have in the comments section.